Today's topic is how to manage difficult behaviors in individuals with a brain injury. And this brief video is geared towards caregivers or family members of a person with a brain injury, specifically understanding prevention strategies for problem behaviors. So, some of the common behaviors that often emerge after an individual acquires a brain injury are depression, which actually 25% of individuals with brain injury experience at some point, aggression, some difficulty with self-control, impulsiveness or poor judgment, that's a very common one, getting stuck on one idea or activity, impaired self-awareness, not having insight into their level of deficits or overestimating their abilities, and some difficulty participating in or being part of social situations, especially after the brain injury. This by no means is an exhaustive list. It's just an example of some of the more common behaviors that family members report their loved ones experience after a brain injury. So, the point I want to make today is that we can try to change the individual and how they behave, or we can really learn how to adapt to their behaviors and change our own responses as caregivers and family members. And personally, I think that that's the easier route to go because it's much more difficult to try to change someone else than it is ourselves. So today we're going to talk about the PPPR of managing difficult behaviors. And what that stands for is setting yourself up for success by predicting possible behavioral issues. That's the first P. Attempting to prevent problem behaviors when they occur. Having a plan, the third P, when the behavior does occur. And learning to respond, that's the R, to shape appropriate behaviors in your loved one. So first we have to predict behavior by looking at when it happens, how often it occurs, who's around, what's going on before and after that behavior happens, so that we can predict when it might occur again. And most behavior is serving a purpose for the person who is executing it. So they either are trying to get something, maybe it's a feeling or an object or attention from someone. They might be trying to avoid something. Again, it could be avoiding a feeling or a responsibility, having to do something, or a certain person or place. Or they might be trying to escape from something that's unpleasant, whether that's a feeling or a person or a sensory effect. So by predicting and tracking behavior, we can learn what purpose that behavior is serving for the person. So the second step, the second P, is preventing problem behaviors before they occur. And this is really important for family members and caregivers to know. So some prevention strategies are to ignore behaviors you would like to decrease, especially when safety is not an issue. To model behaviors you would like to see in your loved one. To avoid situations that provoke behaviors you're trying to reduce. To give emotional support and encouragement, be consistent, use repetition and have patience, structure the person's environment and plan plenty of rest breaks, match your expectations to the person's abilities, redirect the individual rather than challenging him or her, and definitely seek professional help sooner rather than later. The third P, have a plan, helps you when a behavior inevitably does occur, even if you've done your best to predict it and prevent it. So an example of a plan is to identify rewards to redirect the person when that behavior does occur. So that way they're motivated to select a different behavior in that situation. And good incentives are money, gifts, food, time with certain people they like to be around, or maybe not having to spend time with someone that they don't want to be around. So identify those incentives that are going to motivate the individual and get their input on what that would look like so that your plan is effective. And finally, be ready to respond when the behavior does occur, even if you haven't been able to predict, prevent, or plan for it. And again, by being emotionally supportive and encouraging and helping to redirect the client rather than challenging him or her, it's going to help you more effectively manage those difficult situations.
Brought to you by the Brain Injury Alliance of Montana and the Department of Health and Human Services.